Welcome everyone, and thank you for joining us. My name is Cathy Pearcy, and I am the Community Education Coordinator for Ontario for Osteoporosis Canada, and I am very pleased to be your presenter today. Speaking of Bones is our National Speakers Program of Osteoporosis Canada. It is usually, so this presentation is usually delivered by our trained volunteer speakers in many communities across Canada, but because of the times we're living in, today we will be presenting this presentation virtually, and I'm really glad that you're here joining us today. So to submit a question, on the side panel of the right side of your screen, you will see a box that says questions. Type in your question in the text box, and we will receive your question to ask at the end of the presentation. So Heather Eatson, my manager, will be helping with the questions at the end of the presentation. So you may submit a question at any time during the presentation, and it will be addressed during the Q&A period if time permits at the end. If we do not get to all the questions, we can send you an answer through your email. So let's get started. So as I mentioned, this is our kind of our national speaker presentation. And I just want to preface at the beginning, I am not a healthcare professional. I am an educator. So this is kind of a really nice overview of osteoporosis and bone health. So Osteoporosis Canada, our role is to educate, empower, and support those living in the community with osteoporosis. We were founded in 1982, and we were the first charitable organization in the world dedicated to serving those with or at risk of osteoporosis. All of our information that you'll see on our website or any of our handouts, and I've added a couple of handouts to the presentation today, just want you to know that they are all vetted from our Scientific Advisory Council, and that's a group of experts of medical professionals that guide us with our research. So this presentation is going to be broken up into two parts. Today we're going to be doing the first half. We're going to look at bone basics, fracture risk assessment, and nutrition. And then I hope you join us next Monday at the same time, and we'll go over exercise and movement, medication options, and falls and broken bones. So let's get started. So bone is living tissue that changes throughout a person's life. It consists of a framework of protein that is strengthened and hardened by calcium and phosphorus, and this combination together helps our bones become strength and actually flexible as well. So the amount of bone tissue is called a bone mass, and the density refers to how compact the bone structure is. Our bones go through a remodeling process our entire lives. So on this slide, you will see the little pink cells, and those are called the osteoclasts. And these osteoclasts, they take old bone off. The osteoblasts, or the builders in the middle, lay new bone down, and then that process is complete. Bone mass is maintained when both of these are in balance, the osteoclasts and the osteoblasts. And bone loss occurs as we age because new bone is not laid down at the same rate as an older bone is lost. And then we can end up with thinning bones. So as we age, our bones increase in size and strength until we reach what is referred to as the peak bone mass. So for the ladies watching the presentation today, that's usually your peak bone mass was reached between the age of 16 and 20, or that's the height that you were as an adult, an adult. And for the gentlemen, and I hope there's lots of gentlemen on the call today, your peak bone mass was reached when you were about 20 or 25 years old. So, and then our bone mass kind of stays the same for a while. So again, we're really wanting to reach our peak bone mass when we're teenagers. And then in about our mid-30s, we start to lose bone, and that's a normal process, about 1% a year. Ladies, when we go through menopause, that bone loss increases to about 2 or 3%. And the gentleman, your testosterone levels start to drop, usually around the age of 65, so that can affect your bone density as well. So here we have a picture of, on the left-hand side, of what normal bone would look like. And you can see there's tiny little holes and things, but that's for blood vessels and things to go through. But on the right-hand side, you can see what osteoporotic bone might look like. And you can see how that could fracture very, very easily. And so sometimes osteoporosis is called the silent thief because there's actually no symptoms associated with the deterioration of bone. So you can't actually feel this happening. So usually the first sign of osteoporosis, unfortunately, is a fracture. So osteoporosis can be primary. So bone loss can be related, as I mentioned, to menopause because the estrogen levels start to drop in our body, and testosterone. It could be related to age. So as we know, it's just things start to wear out the older we get. So that can affect our skeleton and our bone as well. And then we have our unknown causes. But then we also are doing a lot of research and learning that there's a secondary conditions. And those conditions refer to bone loss that are caused by other diseases or drug treatments. So some of medication that could affect if you're on a glucocorticoid. So for instance, a prednisone may affect bone health. If you've gone through cancer treatments, those treatments can affect bone health. Different medical conditions that could be affected if you're living with Crohn's, celiac disease, rheumatoid arthritis, type 1 diabetes, or chronic kidney or liver disease can also affect your bone loss. So the most significant consequence of osteoporosis is the increase of risk of a fracture. So when we look at our common fracture sites, the sites that we're concerned about are our shoulder, spine, hip, and our wrist. So over 80% of all fractures after the age of 50 are actually caused by osteoporosis, and that number is startling. So a fragility fracture, you may have heard that term, and you think, well, what is a fragility fracture? Well, that is caused by spontaneous or something low trauma, like a slip or a fall from standing height or less. Simply maybe bending over, picking something up could cause a spinal fracture, making your bed, coughing, sneezing. Someday when we can get a hug again from a grandchild, that might affect your bone health as well. So we really want to let people know that these are the areas that we really want to be concerned about when we're looking at fractures. So in Canada, at least 1 in 3 women and 1 in 5 men will have an osteoporotic fracture in their lifetime. So there's more fractures happening. They're more common than heart attack, stroke, and cancer combined. So those numbers are huge. So fracture is one of the most significant risk factors for predicting future fractures. So if you've had a fracture, our concern is that you will fracture again. And 40% of Canadians who experience a fracture have a history of a prior fracture. So they've had that one fracture that nobody mentioned or talked about before. And that's what we call the care gap. So when we look at the care gap for osteoporosis, I want to just kind of describe this slide a little bit. So on the left-hand side, the purple, you can see if you went into the hospital with a heart attack, 80%, at least 80% of those leaving the hospital after a heart attack have left with a treatment plan, medication, education of how they can improve their heart health. On the other side, we have less than 20% of somebody going into the hospital with a a fracture, less than 20% are getting any kind of treatment, even education, that maybe their bones weren't healthy. So this is something we really need to think about and really work on closing that care gap. So I want to give a little analogy here. So I guess we're not snowing anymore, luckily. So let's say we're out doing some raking. We're getting our yards ready. And you look over and your neighbor has fallen, and they were raking and they have fallen and they broke their hip. And they've had a heart attack. So, oh my goodness, the first thing you're going to say is, oh my goodness, my poor neighbor did not have a healthy heart. That is why they had a heart attack. If that same neighbor was raking their front yard and they fell and they broke their hip, what we want people to think is, oh my goodness, their skeleton is not in good shape. But usually what happens is people will say, well, you know, they fell really awkward or they hit the ground really hard, and that's why they broke. It has nothing. We want you to know the connection that falling from a standing height, like you said, just standing in your front yard and falling over and fracturing, is a sign of weak bones. And there's a huge cost to our healthcare system when people are fracturing and unfortunately fracturing multiple times. We're looking at $2.3 billion in our healthcare system because people are having multiple fractures. They're fracturing 2 or 3 times before they're even being talked to about osteoporosis. So that's what we want to shorten that gap and let people know that that is not okay. So a lot of times people think, well, you know, it's just a broken bone, but there's so many consequences of a fracture that we sometimes don't think about. The increased risk of hospitalization after a fracture or a hip fracture happens, institutionalization. So what that might look like is right now you're living in your own home. Maybe after a fracture, you're not able to return to your home, so you may need a little bit more care. That may look like moving into a retirement home, or if you're in a retirement home, moving to a long-term care home. So that's what we mean when we talk about institutionalization. There is a mortality rate related to osteoporosis that people don't think about. And then the subsequent fractures, so there's multiple fractures after that first one. So there's also that decrease of quality in life, the pain that's associated with the break, that loss of confidence and fear of falling. So if you have fallen before, it's scary. It happens so quickly. And then you start to kind of lose your confidence. Luckily, we're going into the nicer weather, but especially, you know, winter comes around again and you start to think, you know, I don't really want to go out much because I'm worried about falling. So that really starts to affect on people's emotional health as well. So I want to talk a little bit about hip fractures here. So there's approximately 30,000 hip fractures that occur in Canada every year. But even more Canadians suffer osteoporotic fractures of the spine, wrist, shoulder, and pelvis. So these numbers are even greater. 28% of women and 37% of men will die of complications after the following year. So complications could look like a blood clot that is set in, or maybe pneumonia because they weren't able to move around like they were before. So something really, really to think about. And now we're going to look at spinal fractures. Interesting, 2/3 of spinal fractures actually go unnoticed. People don't even realize that anything has happened. They may feel, you know, a tightness in their back and think, oh my goodness, I've pulled a muscle. And then eventually it goes away, or it's an acute pain that they get and they know. So some things that could happen. So when you're looking at yourself, there could be height loss that's happening that you don't even realize. You can see our little skeletons here. The first one, this is a 55-year-old skeleton, and they're standing nice and tall. 10 years later, there's a little bit more of a curve. And again, another 10 years, we're looking at even a larger curve. So you can see the curvature in the back is called a kyphosis. And what's happening is all of those organs still need somewhere to go. So they start to get pushed out and things kind of get squished in there. You can kind of see how the skeleton, their belly is kind of protruding. Well, all the organs are still there, but there's less space for them. So breathing becomes more difficult. Bowel movements become more difficult. It's harder to sleep in that uncomfortable position. So I want to do a little exercise. I usually am doing this in front of people, but if you'd like to join in with me, I'd like you to find the top of your rib cage and then the top of your hip bone. Ideally, you should be able to put 3 fingers in between that space. So when we look at the little skeleton that's 55 years old, see how there's space between there? You should be able to put at least 3 fingers in there. Now I'd like you to take a nice deep breath. And that's pretty easy to do. Now, if you just bend forward slightly, what I'm hoping you'll notice is that space that you're holding with your fingers, that space gets smaller. And that's what happens with the kyphosis. Now as you're bent over like this, try and take a deep breath. It's much, much harder to take a deep breath, again, when you're all bent over like that. So that's kind of a feeling that might happen with these spinal fractures. And again, spinal fractures go unnoticed. So sometimes you might have an x-ray, a chest x-ray to look at your lungs, and the technologist will see that spinal fractures have actually happened. So again, we're really concerned too about height. So we want everybody over the age of 50 to at least have their height measured annually. That should be on your doctor's charts. So men with osteoporosis. So if there's any gentlemen in the audience today, I'd like to thank you for joining us. Usually we think of osteoporosis, unfortunately, it's still perceived as a woman's disease, but we're trying very, very hard to change that, because just like women, men, you have a skeleton as well. Unfortunately, we're about 30 years behind in what we know, but what we do know is that more and more men are being diagnosed with osteoporosis. So it's something that you definitely need to be aware of. So not only, do the ladies need to have a bone mineral density test that we're going to talk about, you too need a BMD done as well. So I want to move on to the fracture risk assessment. So how is osteoporosis diagnosed? And again, you'll see we have a handout here on the presentation today so that you can download and read through, because all of the information that I'm sharing today you can find on our website as well. But how is it diagnosed? So we're going to look at a bone mineral density test. So this is a very easy test to do, actually. It's very non-invasive. It doesn't hurt, which is nice. You lie on the table. In some areas, you may have your knees bent and up over that block. So we want everyone, all men and women over the age of 65, to at least have a baseline and get started. If you have, a family history of osteoporosis, or if you've already fractured, that's when you would maybe start looking at a bone mineral density test at an earlier age. Saying here, younger men and women under the age of 50, again, with a certain disease. Like we mentioned, if you've gone through cancer, it's going to affect your bone health. If the medications that I mentioned, the different illnesses that people may have or conditions may also affect your bone mass, that's when you might have a BMD done at a younger age. And then absolutely all postmenopausal women and men 50 to 65 that are at risk of a fracture. We would like them to have a BMD done. As well, we really encourage people to go to the same clinic as much as possible. So wherever you've had your initial one done, you'll have a more true reading if you continue to go to that same clinic. It's just the way the machines are calibrated so that you're being tested always on the same machine. I know that doesn't always work for people if they move, but that's just a little tip. So this used to be the end-all be-all, whatever your bone mineral density test came back as, you were either osteoporotic or you were not. But we're looking at people more holistically now. So your bone mineral density result is one of the results that we're looking at, but we're also looking at age. We know that osteoporosis increases the older we get. When we look at male and females still are at a higher risk of osteoporosis, but as I just mentioned, more and more men are being diagnosed with osteoporosis. Have you had a previous fragility fracture? Did you fall and trip at the age of 57 and you broke your wrist and nobody said anything about it? That's a warning sign. So have you had a previous fracture? That's another little check mark. The other risk factors, again, would be the medication and different medical conditions you might be living with. So this assessment gives a more accurate prediction of the fracture risk, instead of just the bone mineral density test alone. So this is one of the tools that your healthcare professional will use to see what your risk factor is. I'm just going to do a really quick overview, but on our website, Dr. Bill Leslie does an amazing webinar diving even deeper into these risk tools that our doctors are using. So please check that out as well. Mine is just going to be a nice overview. So the doctor can plot you on this graph, and then it will kind of spit out the information of, are you at low risk, moderate risk, or high risk of fracturing. So we can take an individual, let's say a 60-year-old, and their bone mineral density test comes back at minus 2.0. So when we plot that on the graph, that individual is at low risk of having a fracture within the next 10 years. So let's put 15 years on. So we're at 75 now, and maybe their number has never changed. It's still minus 2.0, but just because of the age the individual is, that's moved them into a moderate risk, or you've moved down a category. So that's kind of one of the tools that your healthcare practitioner will be using when they're looking at the diagnosis. You can also go online and kind of plot these, but again, like I mentioned, Dr. Bill Leslie does a wonderful interpretation and explanation of this tool. So the next area I want to get into is nutrition. So the beginning part of the presentation, those are kind of a risk that there's not much we can do about it. Those are our genetics that we were handed from our parents. Like I said, because it does run in the family. But the next section here with nutrition, this is something that we can change. We can change what we're eating and what we're putting into our body. So calcium is kind of the main thing when we're looking at our bone health. And calcium is found in every cell in our body. And we need calcium for our body to function. And our body stores it in different areas. So it stores it in our cells, in our blood, but kind of the bank account where most of it is stored is in our skeleton and our teeth. So if we do not get enough calcium through our diet, because our body does not make calcium on its own, we have to feed our body calcium. If we don't get it enough, it will just go, okay, you know what, there's a whole bunch hanging out in your skeleton, so I can take it from there and give it to the cells that need it. So that's why it's important to be eating calcium through food every day. So when we look at this graph, there's different ages and the calcium requirement. So I'm going to focus today on the 50 plus group. And so we're looking to get about 1,200 milligrams of calcium a day. So that's kind of a number. So let's put that number into what that might look like. So our organization, Osteoporosis Canada, strongly recommends obtaining calcium from food sources whenever possible. So that's looking at eating a balanced diet with calcium spread out throughout the day, as well as protein. And if you're not getting enough through food, we can talk just briefly about supplements. But again, we really encourage to do calcium through food first. And again, on our website, we have a great little calcium calculator that you can input kind of what you've eaten for the day. It would give you how much calcium that food and serving size has, and then it will give you a number of how much calcium you've had that day. So that's a great little resource. So where do we find calcium in our diet? So dairy products is always an easy go-to. Cheese, yogurt, milk, ice cream. So when you're looking at one serving, so one serving of milk might look like a cup of milk, or 125 milligrams. That's roughly 300 milligrams of calcium in it. So if you can handle dairy products, 3 dairy products a day, you're up to 900 milligrams, and then you add in your dark leafy vegetables contain calcium, kale, bok choy, broccoli are great sources of that. Our fortified foods, don't forget about those. So a lot of orange juice now is being fortified with calcium. Also, we can look at, a rice milk or an almond milk. They've been fortified. A tip here is if you're doing a fortified beverage, give the container a good shake just to make sure that all those nutrients are mixed up throughout the contents. And then we can look at sardines and canned salmon with the bones in. So I know I can't see you or hear you right now, but half of you will probably say, oh my goodness, I open that can of salmon and I throw those bones out. And the other half says, no, I've always just mushed them into my salmon when I have my sandwich. So if you're looking at getting your calcium from canned salmon or sardines, you need to keep those bones in there. They need to be crushed up really small because that's where the calcium is. If you're that person that's throwing it out, when you have your salmon sandwich, maybe a nice piece of cheese on the side or a little glass of milk to go with it. So those are some ideas of where you can find calcium in your diet. So I mentioned we'll talk a little bit about supplementation. So again, I really want to strongly encourage people to get their calcium through food, but sometimes that's not always possible. So calcium citrate is another widely available form of calcium. It is more easily absorbed than calcium carbonate and can be taken at any time, but has less elemental calcium in it. Calcium carbonate has more elemental calcium, so it is less easily absorbed to be taken when taken with food. So again, as I mentioned, if you can handle food or dairy products, that's probably easier than trying to remember to take a calcium supplement. Another tip that I usually like to give here, because I talk to many seniors and they say, the thought of a glass of milk is really not appealing to me. So I kind of chuckle on that. And I've got 3 teenagers myself. So as the kids were growing up, and you may remember this too, that sometimes you need to hide food so that your kids will eat it. You hide the vegetables. So maybe you need to do that for yourself. So maybe hiding some calcium into making a pudding, a nice rice pudding or a pudding, maybe making a cream-based soup, cream of broccoli, cream of cauliflower. You can add it to baking. You can do skim milk powder or yogurt into muffins or some baked goods. So again, hiding those dairy products so that your body's still getting the calcium. Fun little tip there. Now we're going to move on to vitamin D. So vitamin D is another really important vitamin that we need to keep our bones healthy and strong. The vitamin D, the role that they have together is it helps increase the absorption of calcium. So there's a few natural sources of vitamin D. So we recommend everybody living in Canada, no matter what their age, definitely needs to be supplementing vitamin D every day. And the other area of research that they've looked at is vitamin D also improves the function of muscles. So again, it helps improve our balance and helps to prevent falls. And that's our kind of main focus, is we want to prevent those falls from happening. So naturally, we can get some vitamin C through the sun. It helps us produce vitamin C. However, we're in Canada, and so over half the year, the sun's not strong enough for us to get that vitamin D. As well, in the summer, if we're using sunscreen, that vitamin D can't get through. And as well, as we get older, we seem to be inside more often, wearing longer sleeves, so we're just not getting as much sun on our skin. So that's why we recommend that you supplement with vitamin D year-round for all adults. So how much vitamin D do we need? Again, I'll focus on the 50+ group, and we have a range from 800 to 2,000 international units is what we're looking at getting. So vitamin D comes in many different forms. You can get liquid and gummy bears and soft gels. So just kind of finding what works best for you and how you can swallow that down. So your pharmacist would be a great resource to kind of give you some different options on different ways that vitamin D is that you can purchase it and you can take it. So, and then the last area when we're looking at nutrition is protein. So protein is really important as well, because bone is made up of protein. So it's essential for bone strength and flexibility. And so protein comes from foods such as plants and animal sources. We can find it in meat and fish, eggs, dairy products, seeds, nuts, and legumes like beans and lentils. So adding, again, looking at your plate and seeing, do you have a protein source in there? Because your bones will love you for that. So that's kind of the first overview. So I'd like to just wrap up. So where can you find more information? So a great place to find just kind of an overview that I've gone over everything that I've talked about, you can find on our website, www.osteoporosis.ca. On there, I want to also talk about COPIN. So COPIN is the Canadian Osteoporotic Patient Network. This is a group of people from across Canada. A lot of times they're patients, and they give out information for patients, from patients. So it's a newsletter that you can sign up to on our website, and will come to you. It's an email that will come to your inbox once a month, and they'll give you information on upcoming webinars, recipes, different information. So that's a really great resource to be part of. You can find us on Facebook, Twitter, Instagram, and YouTube channel. And I know probably a month ago, some of those probably sounded crazy, but the times we're living in, maybe you're embracing this new technology and finding different ways to get information such as this. So, if you join Facebook or Twitter or, just to reach out to family, see if you can find us on there as well for more information. And then you can connect with different people across the country. And there's just a couple people I want to mention. So my role as a community education coordinator in Ontario is recruiting volunteers and training them on this presentation to bring out to community groups before this pandemic we're in. And the country is divided into different regions. So Liz is in Region 1 in BC and Alberta. So if you're listening from the West Coast, welcome. And Liz would be your contact. Sandy is joining us from Region 2, and she looks after Saskatchewan and Manitoba. As I mentioned earlier, I look after Ontario. And then Heather is joining us today as well, and she's looking after Quebec and the East Coast. So we've got lots of different people on the ground across the country, all trying to help those living with osteoporosis, to help with education and empowerment. So I'd like to end this part of the presentation and open it up to questions.
Hi, everyone. This is Heather, and I have been looking at some of the different questions, Cathy. So there actually are a couple here about exercise and medications. So we will save those for part 2, which takes place next week. There was a question about calcium. If you can remind people where they can find the calcium calculator on our website. And as well, there was a question, if a person doesn't like to drink milk, can they get calcium from other sources in their diet?
Okay, so the first one, yes, the calcium calculator is on our website. You can put it into the search bar and it will pop up. So yes, so that's a normal. So the second part of that question, can we find calcium other ways in our diet? Yes, dark leafy fruits or dark leafy vegetables, those kale, bok choy, those nice rich dark green ones have calcium in them. Almonds, oranges, you can find calcium. Again, the fortified beverages, as I mentioned. The easiest, though, for the biggest bang for your buck is going to be dairy products. And that's why I mentioned if dairy is really not your thing, if you're not lactose intolerant and dairy is just not your thing, that's when I mentioned about hiding it into, a soup or a pudding, or adding it into some of your baked goods. And then you can get your calcium that way. If it's a lactose intolerant issue, that's when you want to start looking at, maybe a non-dairy alternative like a soy milk, almond milk, that sort of thing. Using the supplements as an absolute last resort. So that's why it's nice to use the calcium calculator, because it will show you probably about 3 pages of different areas of different food groups that would have calcium in there, to give you an idea of where else you might find some calcium. I hope that answers that question.
Yes, okay, thank you. There was a question about vitamin D as well in food. Can we find vitamin D in our diet?
There's a few places you can find vitamin D. It's fortified into our eggs, and fish has vitamin D in it, but most people are not eating fish on a daily basis. It's also fortified into our milk. So if you are drinking milk, you're getting some vitamin D, but the amounts we need, as I mentioned, between 800 and 2,000 international units, it's really almost impossible to get that amount with just our diet itself. So we do need to be supplementing with that one, with the vitamin D.
Okay, thank you. There's another question about vitamin D. Does our skin absorb the sun rays for vitamin D production the same way at all ages?
No. As we get older, you may notice that your skin, as we age, your skin gets a little more thin, I guess is a way to say it. And so the body doesn't absorb it as readily as when we were younger. And again, as I mentioned, if you're wearing sunscreen, or as we get older, we're wearing, more long sleeve shirts. So no, our body does not absorb the vitamin D as readily as we age.
Okay, thank you. I had a question. We've had a couple questions regarding diet, and some people are talking about other chronic diseases that they're living with. So how best do you balance a diet for healthy calcium and healthy bones versus another diet that you might be on for a chronic illness?
My suggestion for that would be to use the resources that you have in your community. So I would suggest talking with a dietitian. We have the Dietitians of Canada. You can actually go onto their website and connect with a dietitian to talk about that, because sometimes we do know certain foods, right, cause inflammation and different things. So some foods you don't want to have if you're living with another condition like arthritis or if you're living with diabetes. So you want to really look at this. So my suggestion would be to connect with a dietitian, either through Dietitians of Canada or many, I know I'm in Ontario, so many healthcare practitioners in Ontario are part of a family health team where there's a dietitian on staff, so that you can actually have an appointment with a dietitian to go over what your diet should look like. So that would be my my suggestion, would be to sit down, and then it's more individualized to you specifically and the different chronic conditions you're living with.
Okay, thank you, Cathy. There's another question here about osteopenia. Are the risks of fracture similar at this stage of bone loss?
So the term osteopenia was a term that we used many years ago. We don't use that term any longer. Now we're looking at the risk of fracture. Are you at a high risk of fracturing, moderate, or low risk? So I've heard a physician actually say, so being osteopenia is kind of like being kind of pregnant. You're either pregnant or you're not, and either you have low bone mass or you don't have low bone mass. So it's not really a term that we're using like we did years ago. So at this point, we're looking at your fracture risk. So you can live a healthy life with low bone density. Our concern is, are you going to fracture? Because that's where the complications come in.
Okay, thank you. Well, again, I think there are some questions that we can hold for the next presentation on Monday. So I don't think there's any other questions right now. So I think on behalf of Osteoporosis Canada, I wanted to take this time to thank Cathy for today's part 1, Speaking of Bones presentation. Our hope is that you have all learned something new today that you can take with you moving forward. It is important to us that you let us know what you thought of this presentation by filling out the evaluation survey. This survey will be sent to you in a post-presentation email after the presentation today of part 1, as well it will be sent to you next week after part 2. As Cathy said earlier, if you would like more information on bone health or other virtual presentations that we'll be holding, you can access that on our website, www.osteoporosis.ca, which is on the screen. I wanted to give a special thank you for all of you, everyone, for joining us today. And we really hope that you can join in part 2 on Monday, April 27th, at the same time, 1 p.m. Keep well and please be safe. Thank you again.